Well, thanks so much for the invitation today. Thanks to Rabina and CEIU generally for this invitation. I would like to say that the CCPA, the organization I work for, is a charity. We operate on the support of our members. CEIU is, in fact, an organizational partner of the CCPA and has a seat on our members' council as a result. If you would like to be a supporter of the CCPA, there is a QR code there that you can scan with your phone. You can support the CCPA personally, or you can also support us through your locals. If you like this analysis that you see tonight, this analysis is only possible because of the support of organizations and people like yourselves that want to see more of this research. So I know that CEIU members are very concerned about the job impacts of the CER cuts. We are obviously going to go over that in the course of this evening. I would like to point out that I think that the service cuts are a lot more important to folks outside of the NCR. And tonight we're going to look at both over the course of the 40 minutes or so that I've got. Broadly in my presentation, I'm going to start off with the CER impacts across the entirety of the public sector compared to previous cuts, what those look like, and then dive into more of the very specific impacts on staffing at IRCC, ESDC, and IRB, but also in terms of some of the preliminary details that we're starting to put together on the service impacts of those job cuts and the CER cuts more generally. So you can put questions in the chat at this point, and I think we've got about 15 minutes worth of questions at the end of the presentation, and hope to wrap up around 8 p.m. tonight. So let's move to the first slide, please. So I think it's worth setting the table for what has happened here, how it has happened, what the timeline is for what has happened, and what is the timeline going forward to get more information on these cuts, because we do not know the full details at this point, although that is unfolding day to day. This certainly started in the election campaign of the spring of last year, where both the Liberal and Conservative parties put out very extensive cuts to the federal public sector. In earnest, though, this started on July 7th, when letters were sent to ministers telling them all to find 15% cuts across the board. Now, at this point, there were 3 departments that were on the protected list. And so these departments did not have to show 15% cuts. They only had to show 2% cuts over the course of the next 3 years. They were D&D, the RCMP, and CBSA, Canada Border Services. And these cuts were against whatever their 25-26 allocations were. And so it's important to understand what was included in that amount that you multiply by 15% to get the amount you have to cut out of your 25-26 main estimates allocation. It was certainly professional services, and it was certainly personnel. And so this is staff and professional services of things like outsourcing and so on. The other big part of it, though, that was included, that was not expected, was transfers. Transfers are included as well, with some big exceptions, but transfers broadly are included in this cuts package. So these transfers don't include things like transfers to individuals for, say, the Canada Child Benefit, or transfers to the provinces for health and social services, for instance. But outside of those big transfers, the rest of the transfers were absolutely included. And so those make up an important part of this cuts package, with some big exclusions. And this broader cut, I think, should be seen in the end, not so much as a budgetary cut, but as a straight up trade. All of the cuts being faced by departments across the board are going to fund D&D. It's about $60 billion on both sides. So we're seeing about $60 billion worth of cuts over the next 4 years as a result of the CER and some other cuts. And we're seeing an increase in the D&D expenditures of about $60 billion. So this is almost dollar for dollar over the same period. This is not meant to pay for a reduction in the deficit. It's not meant to pay for a tax cut. It's meant to pay for a huge expansion in D&D, roughly a doubling of the Department of National Defense's budget over the next 4 or 5 years. Now, some of this cuts that you are seeing in the departments you work in or across the federal public sector and that are going to be moved to D&D will result in some new jobs at D&D. And I'm sure this is not lost on you that while you are facing cuts, D&D is actively recruiting. I don't think that they will recruit anywhere near the number of jobs in the aggregate that will be lost. And we don't have the estimates at this point as to how much D&D plans to hire on its public services side. I mean, it has the active military side, but also has a big public services component. We don't know what those numbers will be, but there will certainly be some hiring there, as I'm sure folks have already seen. It'll certainly not offset the cuts that we have so far, and those have yet to really be included in these cuts estimates. I should say that this not only applies to all the departments, it also applies to the appropriated Crown corporations that will see a similar requirement for showing 15% cuts. Now, some departments are, in essence, transfer departments. That's their role. They just move money someplace else. And so one of the interesting pieces of this is as we move to the updated list, where we include some of the small departments like the Auditor General and the PBO that ends up being protected. This happens in the early fall. And then we move to budget 2025. We actually see a big expansion in the umbrella of protected departments. And so it goes beyond D&D, the RCMP, and CBSA, and moves to include the granting councils, which is SSHRC, NSERC, and CIHR. It includes the Indigenous departments of CERNAC and ISK, and it also includes women and gender equity. Now, the granting councils and the Indigenous departments are largely transfer agencies, and so, or transfer departments rather. Most of their money isn't on their own staff. Most of their money is in transferring federal dollars to some other level of government to do something with. In terms of the granting council, is to support small and medium-sized businesses in sectorally important areas. For the Indigenous departments, it's largely to support First Nations governments in the basic provision of things like education and healthcare. Now, all of these cuts that we're seeing in budget 2025, these are on top of the cuts that several departments, particularly IRCC and CRA, already underwent in 2025. This happened in early 2025. And this was actually a result of a previous round of cuts called the Refocusing Government Spending cuts. These are actually Trudeau cuts that took a couple years to get digested, but were actually hitting departments in the early part of 2025, which folks at IRCC know all too well. These are in addition to those. And so, as we'll see later on, this is cuts on top of cuts on top of cuts, as I'm sure folks are well aware if you're trying to track this over time. Now, we saw budget 2025 come out in November. And so there were certainly, I was actually surprised at the level of detail that we saw there. We didn't see that level of detail this early with the Harper cuts in the early 2010s. And there has been some ongoing updates on the staffing side. So there's actually a website that is showing the staffing impacts of many departments, not all of them yet, but many departments. And we'll look at that in some detail in a couple slides. Importantly, though, I think the big next piece of data that's coming is going to come in about 3 weeks' time, which is the departmental reports. It's my understanding from some internal discussions, there will be a lot of detail in those internal reports about what exactly is going to be cut in terms of not sort of, the broad categories that we saw in the budget of, realigning government priorities, kind of vague categories, but really specific to the department categories. That's going to come in about 3 weeks. The main estimates came out last Friday, and with them, there is some additional detail on transfer changes, but the big next dump of data will be in about 3 weeks. And so this is something I'm very much paying attention to. But in the meantime, we actually have a reasonable amount to go on, much more so, frankly, than we knew in November 2025. So let's go to the next slide there. So I did want to put this in context of the major cuts to the federal public service. We have 3 major rounds of cuts that happened over the last, 40 years or so. We have the Chrétien Martin cuts of the late 1990s. We have the Harper cuts of the early 2010s, and we have the projected cuts of today. So when we look at these 3 major cuts to the federal public service, the biggest ones were certainly the Chrétien Martin cuts of the mid-1990s. This followed the 1994-95 Martin budget when he was Minister of Finance. It resulted in this is the actual loss of almost 20% of the federal public service, or about 48,000, excuse me, positions. By far the biggest of these three cuts, both in percentage terms as well as in just straight jobs affected. Now, this cut and the cut during the Harper era are are very similar in terms of proportion. So they're both about 10% of the federal public service. In many ways, these are the Harper cuts replayed, decade and a half later. Certainly the number is higher this time around at 38,000 positions lost, as opposed to the Harper cuts which were about 25,000 positions. The projections today, or the projections on this graph, do include the cuts that happened in 2025, particularly at CRA and IRCC. And then in addition to that, the projected impact of the CER. What they don't include is there may be some new hiring at D&D, probably in the neighborhood of a couple thousand new positions on the federal public sector side. But that being said, the cut that we're seeing today is very much the Harper cut, not as big as what we saw in the early 1990s, but still a major reduction in terms of staffing at the federal public sector. So let's go to the next slide. Now, there's been plenty of messaging that, look, the public sector is too large. We have to decrease its size. It's important to understand where we stand in terms of the size of the public sector. This graph shows the size of the public sector to the Canadian population. As you get a bigger population, you're probably going to need more people in the public sector to provide an adequate level of service for that same size of population. You see the arrow points to where we stand in 2025. And certainly that level as proportion of the population is higher than what we've seen in the 2010s and the early 2000s, but it's lower than what we saw prior to the Martin cuts in the early 1990s, and is lower than what we would have seen in the 70s and 80s. And so the cuts that we're seeing today would put the size of the federal public sector close to where it was after the Harper cuts in the 1990s in terms of proportion of the population. And so certainly in the short term, federal public sector's proportion of population is higher, but over the longer term, it's not outside of the historic range. Let's go to the next slide. The other way to look at this too is that, as you have more federal government programs, you do want to have more federal government workers overseeing those programs. And just in the last couple of years, we've seen a major expansion in the number and scope of federal government programs. We have a new national dental care plan. We have a new national child care plan that's promising $10 a day child care across the country. We have a new disability benefit. All of these programs are brand new. They weren't as if you cut something else and introduce this new program. These are brand new programs. And just like all the other programs, they require design, they require continuous auditing, they require tweaks, they require auditing and evaluation. This can't be done unless you have the workers to do it. And so another way of looking at federal public sector efficiency is to look at the average amount of program expenditures per worker. So this is how much money is being spent or how much money is being managed by federal public sector workers in inflation adjusted terms. So these are inflation adjusted terms. And you can see here that, in fact, federal government workers have become substantially more efficient, quote unquote, at managing federal money, managing much more today in the about $1 million per person range, compared to in the 1980s, for instance, where it was in the $700,000 range. This doesn't mean that every single one of you has $1 million budget, which you can spend on whatever you want. This is just to say that you are likely managing programs that are worth that amount or transferring dollars that are near that amount to other levels of government, other agencies, and you're administering that money in essence. And so in that regard, we can see that during the pandemic, federal government workers were managing almost $1.8 million each. That's down to about $1 million per worker, which is pretty similar to what you saw in the lead up to the pandemic. And and is much higher than what we saw in the 1980s. Now, of course, this data, as you'll notice, goes till 2024. And so in 2025, with the big cut of workers that happened that year, in essence, federal government workers have likely become more efficient because there are about 10,000 fewer of them. So the amount left over now has more money to manage per person. And so I think this is also a useful way of looking at the efficiency of federal government workers over the long term when we want to figure out, do we have enough federal government workers to manage the workload in terms of audit and program design that's required. So let's go to the next slide. So let's look at in a lot more detail now about the staffing cuts and the details that we know so far in terms of the various rounds of cuts that have happened since 2024. We do know a reasonable amount of detail in terms of the staffing cuts broken down by department. As you can see from this graph, we saw the elimination of about 11,000 positions between March of 2024 and March of 2025. 7 of that 11,000 were at CRA. 2 of that 11,000 were at IRCC. Folks at IRCC are well aware that this is happening. And there was about another 1,000 that were eliminated from public health over that period between 2024 and 2025. This was part of the refocusing government spending effort. It's actually, well, it's a Trudeau cut. And so this, I don't think, reflects the entirety of the loss in staffing in between 2024 and 2025. The reason for that is that there's a cutoff here of March 31st, 2025. The indeterminate WFA layoffs had not happened yet at IRCC. They couldn't happen that quickly. The term layoffs absolutely had happened at IRCC by that point. But there are more indeterminates here that have yet to be included in this count of this 11,000 count that we've got here. I'll go into that in a bit more detail later on, but this is a bit preliminary and I think underestimates what actually happened between 2024 and 2025. Now, when it comes to CER cuts, we have good staffing details now on 17,000 of those cuts. About 9,000 of those cuts are still missing. So we know they're going to happen. We know which departments they're probably going to happen in. We just don't know what the breakdown is by department. If we look at the CER cuts specifically, that 17,000 of CER cuts that we know about so far, the biggest cut by far is at ESDC. 5,000 positions lost. Now, ESDC did not see a change in positions between 2024 and 2025, or at least March 31st of 2025, but they're seeing a really big hit, the biggest hit actually in terms of positions lost as a result of the CER data we know so far. We've got about 1,000 positions lost at Public Health, 1,000 1,000 at Public Works, 1,000 at Department of Health, 1,000 at StatsCan, 1,000 at GAC, another 1,000 at Environment. And so we have the rest in smaller increments. But those are the big departments affected that we know of so far from the CER. Of that 9,000 where we are still missing the details, the agencies have yet to report and have yet to report their staffing numbers and staffing estimates. So we don't have those yet. And IRB has yet to report any staffing hits. Now, I didn't notice this, I didn't note this in detail, but IRB does not appear to be on the cuts list. They appear to be on the protected list so far, which would mean a 2% cut of expenditures, not 15%. We don't have staffing cut details so far, and this is a bit of an ongoing theme. In some places, we have more details for some departments, in some places we don't. In any event, these position details are being updated now almost daily. This doesn't tell us when the actual layoffs are going to be. There's a 3-year time frame for these CER cuts. They do appear to be weighted fairly heavily in the first year or two. And so, you know, I think that the idea is to get them done quickly. That seems to be the impression. But this doesn't tell us, you know, we got 17,000 here. We know the details. We don't know when they're going to happen. We know they're going to happen, or the departments are planning for them to happen. I do want to point out that for folks that live in Ottawa, Ottawa's job market is already showing the impact of the 11,000 jobs lost between 2024 and 2025. If you look at jobs lost in Ontario cities, all the big Ontario cities, the big Ontario CMAs. The CMA where you see the biggest job loss between December 2024 and December 2025 is not Windsor. It's not Oshawa with all the tariff chaos. It's the city of Ottawa. The city of Ottawa has actually lost 30,000 jobs in 2025, by far the worst in Ontario by a long shot. And an important part of that is these 11,000 positions lost, some additional positions that we don't see the details of, which are indeterminate, that are kind of between the cracks on the timing of when this data is coming in. And then also just the general concern of folks that's been going on since cuts started happening, that they might be next. And so they're much less likely to spend money in the economy, also having an economic impact. So unfortunately, for folks that may be losing their job, that are getting affected notices, I'm afraid to say this to you, but look, folks do not have a lot of sympathy for public sector workers. If we saw 30,000 auto jobs lost, it would be a crisis. But we are seeing 40,000 public sector service jobs lost, and no one considers it a crisis. And so I think, I mean, I don't know what to say about that. I mean, it's pretty concerning for folks that are in the NCR. In any event, I do think we do need to focus on the service impacts of a lot of these cuts. It's not just about staff, it's also about the services that all of you folks provide. And so let's move to the next slide here. So I wanted to take a look at individual departments, the departments of interest for you folks, to see where we are, where your departments compare to the cuts in general. And so here, the light blue line is the departments whose cuts we know about right now. So this is not all departments yet, but it is departments that we know about right now. There are some big departments like CRA that have yet to report their staffing implications, but this is kind of the rough picture. We're looking at a 10% decline roughly in employment between March 2024 and the end of the CER cuts, which will probably be about 2 years' time. You can then compare your own department to the overall kind of general average, which is in light blue. ESTC, you are in orange. There was very little change in employment from the 39,000 people that were employed at ESTC in 2024, very little change between 2024 and 2025. But there's 2,400 cuts that are coming from the CER. At this point, there's extremely limited visibility on what the service impact will be. I look forward to your insight into that, because I don't know. There were no hints in the budget. There were limited hints in some other documents that I'm seeing. But really, we have very little visibility into what the service level impacts of that are going to be. I think, again, as I said earlier, we'll likely have a much better understanding of that in about 3 weeks' time when ESTC's departmental plan is published. At this point, we just don't know what that big cut over 5,000 positions is going to mean in terms of service level impacts. IRCC, you folks are in, what do you want to call that? Orange, I guess, orange, say. Oh, yeah, sorry, I've mixed those colors up. ESTC, you're in dark blue. IRCC, you're in orange. You can see RCC that, as you know, the big impact at IRCC is not happening as a result of the CER cuts. It already happened. It happened in early 2025 is when the announcement was of the elimination of 3,300 positions, just over 3,000 positions over 3 years. That announcement was made in January of 2025. Most of the positions cut between March 2024 and March 2025 were term positions, almost essentially all of them, as about 1,900 positions that were term and casuals. In large part, we can see those because they could be eliminated very quickly without a workforce adjustment process. And so you see those immediately in the March 31st, 2025 figures. There are more cuts to come as a result of the refocusing government efforts. We just don't see them in the data yet. And so I don't know, there's probably another 1,000 that we're just not seeing in the data yet, just because of timing, but we will see it when the March 2026 data comes out, which is a couple months away. In terms of the CER impacts at IRCC, they're smaller. So it's just over 3,000, or sorry, 300 positions. So much less than what folks saw last year. Um, and so in the entirety of that compilation, the we know of about 17% reduction in positions at IRCC. That probably undercounts it because of the timing on the indeterminate WFAs at the beginning of 2025. So we're probably closer to a 20% reduction in staffing at IRCC. This is going to be similar to what departments faced under the Chrétien cuts, or well, IRCC is going to experience basically what all departments experienced under the Chrétien-Martin cuts in the late 1990s. IRB, there was a decline in employment. You folks are in red. There was a decline in employment between 2024 and 2025 of about 72 positions. We don't know what the CER impacts are right now, and so your line in essence does not continue. But it was very similar to the reduction in all departments as a result of the cuts in 2025. Okay, so let's go to the next slide. So we do have some understanding too of the breakdown of these staffing cuts. You can see that we don't know all of the cuts. We know 17,000. This is the departments that have reported so far on their cuts. Some of these more detailed statistics. We know 17,000. There's 9,000 yet to report, but this is what we've got so far. Across the entirety of the departments that have reported staff cuts, 4% of those staff cuts are execs. And so you can compare that to your individual department and see 53% of those cuts will be workforce adjustment, and the other half won't be workforce adjustment. Now, there's a couple reasons for that. They may be eliminating empty positions for which there is no need for a workforce adjustment. There may be retirements or resignations that they're building into these projections. And there's also going to be non-WFA eligible positions. These things like terms and casuals or summer students, they might be eliminated, but they don't have recourse to a WFA. And so what that means is that roughly half of these cuts that the departments in general figure will result in a WFA. Now, I mean, these are projections at this point, and I don't know the details of these projections. It's going to be relying on things like how many folks do they think will retire, how many folks do they think will quit, instead of going through this process, and therefore they don't have to replace them. During the Harper years, I mean, it's worth noting that there was very little increase in retirements during the cut years, the Harper years. It may be the retirement packages are better now than they were in the Harper years. I haven't done a big detailed analysis of that comparison. But this may be, I'm not sure if the half WFA, half non-WFA is a good projection. We'll probably find out a couple of years from now. Not that that's going to help folks now. It is worth pointing out that across all departments, they're sending out more affected letters than people who will actually go through a WFA. So that's worth understanding. There's about 17,000 positions that are going to be lost, but there's been 23,000 WFA affected letters sent out. And so that's probably a bit of an underestimate, honestly. It's probably more like 2 to 1. So they're probably on average sending out about 2 notices for every actual position they intend to eliminate. And so I don't know if it gives folks pause, but they're sending out more letters than they need to. Just because you received an affected notice does not mean you will necessarily be laid off. Not that that's great news, but in any event, maybe that will help some folks. IRB, again, we don't have details here. I'm sorry about that. They haven't been published yet. What's very interesting, particularly for ESDC, is that for the IRCC, this is only the CER cuts, which are actually relatively small, as you can see here, just over 300 positions. I mean, the big cuts actually happened last year. Now at ESDC, only your elimination of execs is about half of what the all department average is, and so that's relatively low. The other thing I think that this is revealing is you've got a very low percentage of these positions that are WFA. I think what this probably means is that they're going to go after term and term and casual positions much more heavily than indeterminate positions would be my suspicion as to why these numbers are so low. And the letters affected are also very low, I think for the exact same reason that those term positions aren't they won't go through a WFA process. And so you don't have to send them a letter, you just lay them off. And so I think that that's probably what these ESDC numbers tell us. Let's go to the next slide here. This is the proportion of the ESDC's 2025 population. You can see that about 20% of the department's positions are term positions. This is about double the average of the federal public service. And so, this I think is largely going to be, a big part of this is going to be on term employment. I don't think this protects indeterminate workers by any stretch of the imagination, but it will definitely impact more term employments. Of course, we don't have good details on ESDC, and I apologize to not have more service level impacts on ESDC. We have a lot of details on IRCC, but not ESDC. I'm sorry about that. There should be more in the coming weeks. So let's go to the next slide. So I have been watching these announcements like a hawk. I was watching a couple weeks ago, actually, to a report that came out of the Parliamentary Budget Office that looked at one of the big IRCC programs called the Interim Federal Health Program. It was doing some costing on it. I thought that there would be statistics on there on what the CER cuts would be. And they said, no, we haven't included the CER cuts. And I read the footnotes, and it turns out they actually had included the CER cuts. So I wrote this up very quickly and put it to a reporter at the Citizen, and we got front page news. This was a couple weeks ago, looking at IRCC. Let's move to the next slide. The basic finding of that analysis, once you put it into the CER context, is just under half of the entirety of the CER cuts have nothing to do with staffing and have nothing to do with efficiency and back office efficiency and so on. It's just a straight up cut to preventive health care for asylum seekers. And so this is forcing asylum seekers to cover 30% of preventive procedures, things like dental care, as well as paying a new copay on prescription drugs. The department expects that asylum seekers will pay $250 million a year. These are folks who came to Canada with nothing. They aren't going to pay $250 million a year. They're just going to avoid treatment, which will likely mean they'll end up in emergency rooms and doctor's office, for which IRCC will pay 100% of the coverage. But this is just a straight up service cut. This is not sort of efficiency and back office, deduplication and so on. So let's move to the next slide. I did want to return to this refocusing government spending cuts that we saw earlier on, those 1,900 term positions that were rapidly eliminated at the start of 2025. Those people were doing something, and they were hired for a reason. The reason why they were hired was to clear a major backlog in applications. And so this graph is actually a graph of the 7 major application programs. The goal at IRCC is to keep application programs under a 20% backlog, to have under 20% of the applications roll over sort of period to period. And you can see that prior to, about the start of 2023, none of the programs were hitting their target. 0% of the programs were hitting their backlog target. That starts to improve in 2023 and 2024, early 2025. Many of the programs are starting to get their backlogs under 20%. They're getting the backlogs under control. And then you see the major layoffs starting in early 2025, and the backlogs creep back up, and then none of the major application streams are meeting their targets. They go back down to 0 by the end of 2025. And so this is one of the very tangible implications of those staff layoffs in early 2025 is these are just service cuts. I mean, this isn't magic. It's not, there's no AI, there's no voodoo magic going on here. This is just straight up service cuts. Straight up service cuts with real consequences, because cases drag out. They last longer. They aren't decided. Asylum claims are not adjudicated. We're already seeing these backlogs roll over into the federal courts to get federal decisions on court decisions on these, as opposed to going through some of these existing processes. This is not about efficiency. This is just about bad service being provided to folks and dragging out their processes much longer than needed to be the case when, there's a clear example of having better hiring results in lower backlogs in 2023 and 2024. So let's go to the next slide. My other real big concern when it comes to IRCC funding is a program called the Interim Housing Assistance Program. This is a program that IRCC runs. It reimburses cities who have major asylum seeker populations that they are housing. So these are cities that are housing what would otherwise be homeless asylum seekers at their cost. So the cities pay for this, and then they send the receipts to the feds through this program, the IHAP program, and the feds cover it or hopefully cover it. That's the idea. As you can see from the funding of this program, it's very ad hoc. It comes and goes. In the last couple of years, it's actually been reasonably well funded. In 2025-26, the feds were paying 95% of housing these unhoused asylum seekers, and the cities were paying 5%. That's going to go to 75 Fed, 25 city in 26-27. And the real concern is what happens a year after that. Do the cities just eat this cost now that the feds were otherwise contributing to? This is going to fall very heavily on the shoulders. It could fall very heavily on the shoulders of cities. But again, this isn't about efficiency. It's not about AI making everyone more efficient. This is just about downloading. And so I think these are kind of the service level cuts. And these are the realities of how the CER is going to hit home in terms of savings. Let's go to the next slide here. Is very much based too on assumptions around whether asylum claims will drop substantially in 26-27. These are the departmental projections. That may happen, but what if they were slightly higher? I mean, what if we see another situation like Ukraine where you've got a big asylum flow into Canada, asylum seeker flow into Canada? Then all of a sudden, the cities are bearing the cost of that in terms of the housing fund. So let's go to the next slide there. Let's wrap up there. Again, if you like this presentation, you like the research we're doing and the attention that we are calling to some of the departments that you folks work at and the service implications, please scan this QR code and donate to us individually as locals. Thanks so much for your attention, and I look forward to taking some questions.
Thank you, David. I'm going to pass to my colleague Matt here to ask some questions from our Q&A, and please do continue submitting questions there.
Hi, David. Thank you for a great presentation. And I'd like to ask about, so from my understanding, this is one of the first deeper dives into this round of cuts. So could you talk a bit about this work specifically, what you're doing next with it, and then what you're doing more generally on the cuts? Thanks.
Yeah, I mean, this is a preview. You're seeing some parts of a much bigger analysis that we are working on right now that's going to go out and be made public later this week, maybe early next week, that will really do a much more detailed analysis, particularly of IRCC and what the breakdown of these individual cuts are. I'm hinting here at a lot more that's going to be revealed. This is part of several departments that we want to look at in a lot more detail because we have details on some of these cuts actually are, not in the vague categories that we saw in the budget of realigning government priorities to maximize efficiency. But, you're going to lose the service here, or these folks are going to lose health coverage, or these folks, we're going to download these costs to some other level of government. And so this analysis next week, or later this week, early next week, will be the first of that. There'll probably be several more. And then when the departmental plans come out in 3 weeks' time, we'll do even more once we've got even more details on some of the key departments like ESTC, where we actually have very little visibility at this point.
Thanks for that. Another one that came up is just key takeaways. So if you were to stress, based on this work, one or two of the key takeaways that you really feel hit home for you in the work you've done?
I mean, what's so clear at IRCC is this, I mean, this isn't even the CER cuts in particular are not even being taken out against staff that would then potentially result in service impacts that we saw, like we saw in the refocusing government efforts in early 2025. These are just straight up cuts to services, very visible services that somebody else will implement. Um, in the case of refugee healthcare, for instance, or in the case of housing homeless asylum seekers, the cities may well be the ones picking up the tab. It's pretty clear that these are just service cuts. They're just good old-fashioned service cuts. There's no magic here. There's no magic sauce. This isn't about efficiency. It's not about AI. It's just about service cuts. Very measurable service cuts, in fact. Now in IRCC, we have more of the details here that we'll be putting out next week. But that I think is where this should go. This is a story about service cuts to fund defense. It's not a story about cutting the fat or whatever. This is just a story about service cuts.
Thank you. And one of the questions from our audience was around equity and equity data as well. So this, I guess, to both yourself, David, and Rubina, if you wanted to chime in on this at all, but any thoughts on equity data? And just so you know, well over 70% of our membership are women. And obviously, we're trying to get a grasp on equity data, but can you speak to any of the equity considerations with all of this?
Yeah, I mean, it was a big concern when I started looking at these cuts in the summer, that the departments being cut tend to have more women in them. IRCC and ESDC in particularly have big female populations. The departments that are protected, D&D, RCMP, CBSA, tend to have fewer women. And so you end up with this outsized impact, gender impact. There are several other measures that are routinely tracked in the federal government, population statistics. And they include whether groups are racialized, whether groups have a disability, as well as the gender of the population. And so from that, we will be able to determine at least the cuts in, we'll get a much better idea when the numbers come out for as of March 31st, 2026, what at least part of the initial refocusing government spending effort, what the equity impacts were of that. Now, in terms of the CER cuts, I think it's going to be harder to determine that quickly. I mean, we'll probably know it well after the fact, which is a bit irrelevant, frankly. But we will have some idea, I think, at the outset of what has happened, at least in the last 2 years, in terms of some of the equity impacts.
Great, thank you. And this will be a bit of a two-pronged question. We have a question from Jess, who mentioned, and you mentioned this as well, just this public perception of the public service, where, like you said, in the auto sector, that would really have the population reeling and concerned, yet these significant cuts are happening in the public sector, and that public perception is not the same. So if you could speak to a bit about dispelling that and how to challenge that narrative. We are doing a lot of work to try and challenge that in different ways. And then also part of that question was around, you had our population to public service ratio. How does our ratio compare to other countries? The question was around like Nordic countries, for example. How do we compare there?
Yeah, I've never done an international comparison. You'd also have to adjust for the fact that depends if it's a federalized state where you have like a lot of the public sector working for the federal government. In Canada, we've got a federal provincial split where you've got a lot of public sector workers working for provincial governments as well. It depends on the country. I've never done that comparison, so I don't know. In terms of the job losses, I should say, like, it's not that I'm not concerned about auto worker job losses. I'm very concerned about auto worker job losses. Predominantly male jobs that are being lost there. It's absolutely happening, and it's very concerning. The federal public service job losses, predominantly female jobs, also very concerning. I honestly, I'm not sure that we should be fighting that perception per se. I think it's about services, right? I think it's about bringing it home to services, right? Like folks that have come here as refugee claimants cannot get their claims processed because we laid off all the people that process the claims, right? Homeless populations are exploding in particular cities because we stopped funding the cities to provide shelter to them, right? Folks that are ending up in emerge because they can't get dental service for their kids. And you know what the most common surgery, day surgery is for kids in Canada? Dental surgery. And we've eliminated that coverage, or we've made it cost prohibitive likely for asylum seekers. I think that the rubber hits the road on the services side. And I think once you make that much more concrete, then folks say, "Oh, wait a second, I don't actually don't want that. Like, I don't want my emergency room and doctor's office overrun by people because they can't get basic preventive care. Like, I don't want the homeless population to spike in Toronto because we can't house asylum seekers. Maybe these cuts are a bad idea." And I think that is the approach outside of the city of Ottawa. The city of Ottawa actually is fairly concerned about the job cuts and the impact on local economy. But outside that, I would pivot to the services side.
Thank you. And that ties nicely into a question that we had from David, who asked about using this research to fight back. How can we use this as union activists to push back against cuts? So I think you speaking about that service level cuts, service level side of things speaks to it. Is there anything that more you can say about fighting back, using this research to fight back?
Yeah, I mean, certainly CEIU. I mean, this is not lost on having worked with CEIU researchers. It's not lost on leadership and on the researchers that there are a lot of organizations that are also being impacted outside of the workers that are being laid off federally. Anybody working with refugee rights, working with settlement agencies, they're all seeing these cuts too. These are very natural alliances that I know CEIU is already pursuing. I think that's a great strategy. And so these cuts were done in haste. It's clear they were done in haste. There are course corrections. There were course corrections in the budget. There will continue to be course corrections in upcoming economic statements and probably in the fall budget of 2026, where it just slipped through the cracks. Folks didn't realize what the impacts were going to be because they had about 2 months to come up with 15% cuts across the board in their departments, and there are going to be big impacts. And those impacts are undesirable in many cases. And so I think it's also, it's incumbent on us that are seeing these cuts to make clear what these cuts mean in practical terms to folks, practical terms to parliamentarians, in the hopes that they will say, wait a second, that's not what I signed up for. That's not what I mean by, these CER cuts. I think we need to go back. We need to roll back this cut and that cut. I mean, this I think now is the case we need to make. Unfortunately, like they're already happening. I mean, the cuts to asylum seeker healthcare, they're coming into play on May 1st. Like, it is happening, and so we need to act very quickly. But there are natural alliances to be made, and I think because the cuts were done in haste, there are some obvious parts of which we should push very strongly to have reversed.